Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and we are joined by a very special guest this evening, Brogan. Brogan, please go ahead and introduce yourself.
Hi, Cole. Thanks so much for having me. I appreciate it. My name is Brogan Crockett. And just to give you a little bit about where I'm at right now, I was an administrator before, and now I'm currently halfway through medical school. Just to sum everything up real quick.
Such an incredible journey that you've been through. One of the most unique kind of resumes I've ever seen after scouring LinkedIn for many hours I've spent on LinkedIn. So it was really incredible to come across with you, and you have helped me overcome all these scheduling difficulties. So I appreciate you being so flexible. I,
Yeah.
I want to kind of go back and start with where you were at way back in undergrad and what your decision was to go and get your MHA. So what did that look like for you at the time?
Yeah. So I've actually, in order to really tell the story, I have to back up even a little bit further. I've been a paramedic since 2014. I got my EMT in 2012, and I loved that. That was so much fun. Driving the ambulance and responding and helping people. I really, really enjoyed it. And I used it as a way to help me figure out whether or not clinical medicine was something I wanted to do. But I needed to figure out where I was going to fit in clinical medicine. So I worked as a paramedic through my undergrad, through graduate school, and am currently still running on the ambulance occasionally every now and again. So I got my undergrad from the University of Utah in health promotion and education, emphasis in emergency medical services with a specialty in wilderness remote rescue. Because I always knew I was going to go to graduate school, actually. And so I got something as an undergrad that I enjoyed, that I got to have a lot of fun with, which set me up for some really unique opportunities. And so, because of the way that things happened and worked out, I graduated my undergrad without having finished the prerequisites for medical school. And I had a dear friend of mine that I worked with actually on the ambulance who was in a dual MPH MHA program. And she reached out and said, "Hey, have you considered an MHA or an MPH?" And I hadn't really thought about it. And I thought to myself, if I'm going to go back to school, I might as well get a degree while I'm there instead of just fulfilling more credits. So I enrolled in the MHA program, got in at the University of Utah, and enrolled in the class of 2020. And it was kind of a new hurdle for me, learning the business language and the way that healthcare administration works, because I've been in clinical medicine for so long at that point. So that was something I had to learn and overcome. But I don't regret it at all.
What was your reason for originally wanting to be a doctor and getting into the paramedic space?
Yeah, so actually, a long, long time ago, I wanted to be an astronaut, and there's a terrible accident that happened with one of the space shuttles. My mother told me no son of mine's going into space. So I kind of shifted focus, and I found the natural sciences to come easy to me and something that I really enjoyed. And I had a couple of experiences that I got to help people in clinical settings or healthcare settings that really helped kind of direct me that way, including tending to dying grandparents. My mother was a nurse, and so they owned home health, hospice, skilled nursing facilities. So I got to be around that a lot. So, I like to think that I was indoctrinated at a young age. um, but yeah, so I had always kind of grown up wanting to be a physician. What type of physician, I don't know. I hadn't figured that out yet. And then when I got into my paramedic, I fell in love with emergency medicine
Mhm.
and realized that I enjoyed it and that I could do it. And so, I mean, as of right now, I'm still open to a lot of different things, but that's kind of the path I'm leaning towards.
Nice, good for you. And so the paramedic experience, and then your undergrad as well. I know, wilderness medicine is very adjacent. I think that's one of the fellowships you can do from EM, right? They have a
Yes,
wilderness. It's a small cohort. I think there's
very
only like
small.
15 people. Yeah, I used to be into. I wasn't gonna do it, but I used to be into it in terms of like speculating, like how cool that would be to to do that, because they have some really cool things that I know that fellowship does. So you went through your MHA program and you did an internship, of course, as part of the program, but then you decided to do a fellowship as well. I saw. Was that
Yeah.
required, or was that something that you decided to do extra?
So that wasn't required. Out of the 55 that were in my cohort, only 9 of us applied for administrative fellowships.
What was your reason for choosing to do that?
Yeah, I decided, might as well make the best of where I've put myself. I want to be the best trained leader that I can be. And I saw this as an extension of my education and that I wasn't done in those 2 years. And so I hopped into that, interviewed all over, and ultimately landed an administrative fellowship.
Wow. And then how was that fellowship experience at Banner Health? Did you enjoy it?
Yeah, I definitely had a great time. And I have some really great friends that occasionally will check up on me that I made during that time. I learned a ton, and I kind of came full circle from working as an EMT or paramedic in the emergency room because I'm very isolated to just the emergency room to understanding more about how the whole healthcare system works together to take care of our patients.
Absolutely. And so after that experience where you're, so now you have this overview of knowledge, like you're saying, this full circle. W- At what point did you know you wanted to go back to school, get your master's in biomedical sciences, and then get your DO? What did that process look like in your mind? When did you kind of make the decision that you were going to go back?
Yeah, I had a very fortunate experience in my administrative fellowship. Like I said, I don't regret it at all. I had a great time. And it's because of the administrative fellowship that I'm at where I'm at right now. And I've like updated coworkers and stuff as well. But I was in my administrative fellowship. We had kind of ridden out the tail end of 2020 with dealing with the COVID pandemic, and I was dealing with that with the C-suite as well as like trying to manage, our strategic plan for the organization as well and our local market. And I was spending some time with our director of perioperative services. Her name was Kara Snyder, and I owe her a huge thank you because I spent some time with her for about a week learning about what perioperative services and what we did. We had a very busy periop service. I think we had 30 operating rooms that were functioning every day. And, we were in a meeting. She's like, we have some free time. Do you want to go see some surgeries?
Hmm.
I was like, of course I do. And I think I caught her off guard that an administrator would want to go watch surgeries. And so I gowned up and, changed into scrubs, and we popped in and out of different surgeries and met the surgeons. And I got to also study throughput of our patients through pre-op, the OR, and into PACU to try and improve some processes there. And while I was doing my time in perioperative services, I spent time with a surgical pathology resident. And he approached me and he's like, "Hey, do you want to go watch an autopsy?"
Wow.
And I think I also caught him off guard. I was like, "Yeah, of course I do." And so we were in the morgue and we're performing this autopsy and we were chatting, and he's like, "Why is an administrator interested in this?" And I told him about my background. He's like, "Why are you selling yourself short? You clearly love medicine. And I no doubt that you would do well as an administrator and you clearly have a desire to be here. Otherwise you wouldn't. But why are you selling yourself short and not trying to integrate both of those?"
Hmm.
And so I thought about it some more and thought about it some more and was like, "Oh my gosh, I think he's right." So I threw out some applications, put together my application for medical school, finished some prereqs, and ended up doing the post-bac program actually to get me into medical school. Just kind of more as a career transition thing.
That is incredible, and good for you on choosing to go that route. So you're about to go into you're done with. Well, actually, how does your school do it? Because I know usually the first 2 years are like didactic, right? And then
Yeah.
so is it similar to in your institution?
Yeah. So in July, I'll be entering clinical rotations.
Oh, yeah. So you have both the knowledge pieces down, and then you already did some, the fellowship with the administration. So now you're going to be doing the actual, clinical rotations with medicine. So that's very exciting. Wow. So what was that process like doing the application? Was it really nerve wracking because you already kind of had a secured job per se. After the fellowship, they would have probably retained you, or so was it less anxious for that, or was it still as equally like you were really worried about
I was pretty anxious.
that?
I had worked really, really hard, and I had interviewed at some places when I was selecting fellowships and fellowship programs. I'd interviewed at some places that no one from University of Utah had graduated or had interviewed at before. and I was traveling all over the country. Um,
Wow.
and when I had landed this job, this great job with a great organization, and I really like really enjoyed and learned a lot. But I realized that I was giving up something that I could make a career out of, which is
Mm,
hard. I mean, like, not to sell the financial compensation short by any means. It was the most money I'd ever made, only having worked as a paramedic through school part time. And I was learning a lot. I was having a great time. I was able to interact with patients. But to decide to give that all up was a huge decision for me to make,
mm.
and to be like, okay, I'm going to be broke. I'm going to be broke for years.
Right.
And
You're going to be negative. You're going
yeah,
to.
don't get me started on my student loans. But yeah, so it was really nerve wracking. And then with the COVID pandemic going on, and there was a lot of exceptions being made for acceptance to medical school, and I actually never got rejected from a medical school after I applied because they failed to send me in a rejection notice. But I got an email back from the admissions counselor of the school that I'm currently at and said, "Hey, you're missing some of the prereqs." So I immediately called her, and I said I submitted all this, and this all occurred within like 2 or 3 weeks. This whole timeline that I'm telling you. So I rushed to put together the application. I was late to the application submission, and she calls me, or I called her, and we discussed, I'm short some of the prereqs. What do you recommend? And so I was doing distance ed through 3 different universities and finished over 30 science credits in like 6 months in order to start the program. And that got me into the post-bac program, the Master's of Science in Biomedical Sciences. Yeah, so it was a huge leap of faith. I had my orientation for the master's program on like Wednesday, Thursday, Friday, and Saturday, Sunday. I took 4 finals for classes that were required for me to finish before I started the program.
Wow. So I guess that's an interesting thing as well, is we talk about with med students how it's such a long and arduous process, because I mean I took some pre-med course, I took some of the courses, and honestly that's why I decided that I'd rather do what I'm doing now for the moment, is because it was so I mean, you know what it's like. The science courses are hard. And so what is your level of energy like after doing that for so long now, right? This has been a 4 or 5 year journey of kind of constant learning already after completing a bachelor's and a master's. So this is like a long process. How are you maintaining that energy?
I think it's being very cognizant of how I'm doing mentally, recognizing when I'm burnt out. We're approaching. We just had spring break, and so I'm in the final stretch before the end of the semester, and I'm tired. Like, I recognize it.
Mhm.
I'm tired. I've been holed up in a study room for the last 6 months, and so I take every opportunity I can to study outside. I studied outside today for 5 hours. It's been nice weather all day, and so being outside is kind of what keeps me going. I plan bigger activities when I can. I'm friends with some of my professors and faculty, so we go outside and do through hikes or go canyoneering. I went climbing this last weekend. I'm hoping to go mountain biking this weekend for a few hours before I have to buckle down and take an exam on Monday morning. So I think it's being very cognizant of what's going on. I mean, I have pictures behind me.
I was just looking at those. Yeah.
I got married this last summer, so I've been married
Oh,
for 9 months.
congratulations. That's
Thank you
awesome.
very much. I appreciate that. And it's been a blast. It's been a lot of fun. I have an incredible wife, and she's very understanding and very supportive. And she's also in a graduate program right now. She's getting an MPH.
Okay.
Hers is online, and she's the breadwinner right now in our family. And I'm trying to do what I can to support her and her career and her aspirations while also going to medical school full time. So, sometimes we have to just hang out on the couch at home at night after I've studied for 12 to 13 hours a day sometimes while she finishes schoolwork because she's been at work all day.
Wow.
But I'm very fortunate that I married somebody that has similar interests to me as well. And so she's very easy to get along with, very easy to plan stuff with. And she's a better rock climber than I am. So
Oh, that is so funny. That's wonderful, though. And you. So you guys are a power couple. You guys are going to be transforming healthcare. What are your plans? Speaking of that, are you looking at becoming a hospital administrator and a physician? So is that kind of your plan for the future? You want to be involved in both leadership and the emergency medicine?
Yeah, actually, for the last probably 3 months or so, I've been interested in dual board certification in critical care and emergency medicine. So we'll see how things pan out in the next 2 to 4 years. um, but I am interested in ending up in administration. I just don't want to be completely removed from the bedside. I recognize that administrators have a hard job and they have a busy job, but I can't imagine a career for me where I'm not spending at least some of my time at the bedside taking care of patients.
Yeah, absolutely. And I think that makes you a better administrator. So, can you explain real quick what that critical care component looks like? Because I know emergency medicine is 3 to 4 years residency, right?
Yeah. So, in order to get into critical care, you can either do internal medicine, you can do surgery, or you can do emergency medicine, and then it would be a 2 year fellowship after residency in order to sit for the board certification as well.
Wow. And so, what interests you about that critical care component?
I like the procedural stuff. I think that the high acuity medicine is really interesting, and for the last 12 years, I have never seen patient dispositions as an EMT or a paramedic. And
Hmm.
so I spend a very brief amount of time with them, drop them off at the hospital, and then never hear anything about them again unless I pick them up again. So
Mhm.
I'm more curious to see that side of things. I have spent a little bit of time in ICUs, more so as an administrator, where I casually took off my badge, took off my tie, and took off my jacket, so that the RNs didn't all scatter when I walked into the unit. And I was really interested. And my wife is also a clinical dietitian, and it's very nice because she has a clinical knowledge, and so we can talk about patient cases. And she floats through ICUs as well, and I think that's something I could be really interested in. And when I'm tired of working in emergency medicine, I can go work in the ICU, and vice versa.
Right. Wow. Excellent. And then you're going to have that. One of the things that I know a lot of doctors are worried about is it seemed like there was this issue with EM compensation and EMs kind of going down. But what I'm wondering is with your knowledge, do you feel like we're going to see a resurgence of that? Because Walmart, for example, is expanding into some of these areas with their virtual urgent care, and so is Amazon. And what I wonder if what's going to happen is you're actually going to see a higher need for freestanding EDs or EDs in general. Do you feel like emergency medicine is going to continue to be a profession for a long time that's really valued and even get a resurgence in value?
Yeah, so I mean, if right, because I've been in medical school for the last 2 years and master's program before that, we can talk about that side of things. If you look at match rates of people going into emergency medicine, we saw a downtrend with COVID,
Right, we did.
the pandemic, and we saw a lot of PAs and nurse practitioners that were moving in and fulfilling a lot of these roles, but it's because they couldn't get physicians. A lot of the older EM docs were retiring, and with EM becoming a board certification, a lot of these docs were like, I'm done. I'm just gonna tap out. And so you look at match rates last year on match day, there was 550 unfilled seats in EM last year.
I think that's what I read. That's why I was kind of seeing what
Yeah.
your thoughts were.
This year, there was around 120, 125 unfilled seats on match day. And I'm the president of the local or my school's emergency medicine club, coincidentally. And so
Perfect.
we're one of the most popular clubs on campus. We're one of the most active clubs, but we also have the highest student interest, in my opinion, for all the organizations that are there. And if we look at what's coming out through ASEP, American College of Emergency Physicians, or American College of Osteopathic Emergency Physicians, there has been calls for parity between DOs and MDs, right? Comlex and USMLE, and to get into the same residency programs, which combined back in 2020. And then I believe it was last year, maybe, that states started requiring that if you have an open emergency department, you have to have a board certified emergency physician
Mm.
there in order to operate. You can't be staffed fully with NPs and PAs.
Yep.
And I think that was somewhere in the Midwest that first started happening. And I've seen similar trends across the country, or things that have popped up across the country. I also belong to USEP, Utah College of Emergency Physicians. We have our annual summit in about a month from now, actually. But I belong to American Medical Association, Utah Medical Association, and I've participated in a lot of these House of Delegates meetings where that has come up. Students' perception of emergency medicine, the industry, as well as emergency medicine physician unionization and contract negotiation. And when I first told my mom years and years ago that I was going to go into emergency medicine, or that I was interested in emergency medicine, she said, "Why? You're going to be owned by the hospital." I
Mm-hmm.
said, she hasn't worked as an RN in a hospital in several years, more like 20 years. But I said, "Are you aware of how emergency rooms are staffed now with physicians? It's more medical groups.
Right.
And it's one of the more sought after, or has been traditionally pre-COVID, one of the more sought after specialties." So I think we are definitely going to see this resurgence as people view the lifestyle trends start moving towards maybe unionization. We are already organized with Utah Medical Association, American Medical Association, and American College of Emergency Physicians, but they can only do so much. And so I do think that there will be a resurgence, and compensation will follow. And I'm hoping it's not too competitive when I go for residency, so I can get into a residency that I want to go to. But I think it'll become competitive again from everything that I've been seeing in the industry.
Excellent. And that, I mean, it is good in a way to have to compete, it
Yeah.
is good to compete, and we can talk for longer another time. So thank you so much though, Brogan, for coming on and talking with us.
Yeah, of course. Thank you so much for having me. It's been a pleasure.
Of course.